It's 11:02 here in Melbourne, so let's get started. I first like to acknowledge the traditional owners of the land on which we are meeting, and I pay my respects to the elders past and present and the Aboriginal elders of other communities who may be here today. Good morning, everyone. Thank you for joining this month's webinar on understanding silicosis and engineered stone. I'm Sabrina, a Centre for Safe Air postdoctoral research fellow, and I'll be chairing today's webinar. Silicosis is a serious occupational health concern, especially within industries working with engineered stone. Today, we are privileged to have two esteemed speakers, Dr. Sharna Mathieu and Professor Graeme Zosky, who will shed light on this topic. Sharna and Graeme will each give a 20-minute presentation followed by a 50-minute Q&A at the end. So please drop your questions and comments in the Q&A section. So without further ado, let's begin. Our first speaker is Dr. Sharna Mathieu. Dr. Mathieu is the Occupational Lung Disease Program Manager for Lung Foundation Australia within the Policy, Advocacy and Prevention team. She oversees the delivery of Lung Foundation Australia's occupational lung disease portfolio, including the development of preventative resources and annual awareness campaign, support services for people impacted by silicosis and their families, and synthesis of national research priorities and response in occupational lung disease. So we're very glad to have you here today, Sharna. Over to you. Would you like to share your screen?
Thank you so much. I'll just share my screen now. Thank you for that introduction. Hopefully it will be popping up for you all imminently.
Yep, we can see your screen.
Lovely. I'll just make that full view. So thank you so much, Sabrina. Really appreciate it. And thank you so much for the invitation to present today. So yes, my name is Sharna and I am the program manager for our occupational lung disease team here at Lung Foundation Australia. We're really grateful to be able to present on this topic for the Centre for Safe Air. You guys do a lot of amazing work in terms of increasing our understanding of air quality and the impacts on human health. Before I begin, I would like to acknowledge the traditional custodians of country throughout Australia and just pay my respects to elders past and present. I'm joining from Lung Foundation Australia's head office here in Brisbane on the lands of the Yagara and Turrbal peoples. So I was asked to provide, I guess, just a background and an overview to the emergence of engineered stone as a source of work-related exposure causing lung damage here in Australia and indeed overseas, as well as providing a bit of an overview as to the response that we've seen from government and industry before touching on the recent announcement for a ban on engineered stone that occurred a few months ago, as well as just finishing on what Lung Foundation Australia are doing. So for those of you who don't know, Lung Foundation Australia is a charity and we're a respiratory peak health advisory body to the Department of Health and Aged Care. And our vision is really just to enable life-saving lung health and lung cancer research and champion programs that are aimed at helping Australians who are living with lung disease and lung cancer to be living their best life. And one of our strategic pillars is healthy lungs for all. And a key part of that, and in terms of where my role within the organisation fits in, is that primary prevention of occupational lung disease or even occupational and environmental lung disease across the lifespan here at Lung Foundation Australia. So a very simple overview of how we've gotten to where we are today. So exposure to very small particles, respirable particles of silica dust at work is in fact one of the oldest known causes of occupational lung disease. And that of course includes silicosis, but silica has also been associated with lung cancer and chronic obstructive pulmonary disease. Unfortunately, silica dust exposure may also be linked with autoimmune conditions such as scleroderma. And in fact, when we are speaking to people who have worked in the engineered stone industry here at Lung Foundation Australia, we do hear the incredible toll that conditions like scleroderma has on their ability to re-enter the workforce or live a healthy, happy life. Which is a huge problem because silica is a highly abundant and naturally occurring mineral that is a huge component of the Earth's crust. So it's not just to make engineered stone. Any industry or task that is involved in the manipulation or processing of stone, such as mining, quarrying, tunneling through the Earth's crust, it does mean that you are potentially exposed to silica dust. And in fact, it's been estimated that around 600,000 Australian workers are exposed in the construction, mining and quarrying and stonemasonry industries. And that doesn't even include those who are working in industries like tunnelling, where there's the potential for huge exposure to respirable crystalline silica dust. I'm not a physician, but in a very, very basic kind of overview of what silicosis is, it's a preventable fibrotic occupational lung disease with no known cure yet. I say yet because we're really excited to see all of the research that is happening here and overseas, looking at potential treatments for silicosis, in terms of halting some of that fibrosis, whether it be whole lung lavage or maybe it's antifibrotic treatments. It remains to be seen, but we're excited to see the outcomes of that research. Obviously, if disease gets to a significant enough stage, then some people require a lung transplant, but that's not a cure for silicosis. So respirable silica dust, is inhaled over time at work, and the body's immune system attempts to clear the lungs of silica dust, which of course it cannot do. It cannot break down the silica, the crystals, which leads to inflammation, lung damage, and scarring over time. Silicosis can be classified in different ways. There is acute silicosis where exposure has only been for a few years, if that. And then you can have simple silicosis or complicated silicosis, which is also known as progressive massive fibrosis, where the nodules have all coalesced and the lung damage is more significant. And that can happen either classified as kind of chronic silicosis, where the exposure has occurred over 10 years or more, or it can be accelerated, where exposure has been only within 2 to 10 years. And in fact, that is what we are witnessing in the engineered stone benchtop industry, where people are presenting with significant evidence of lung damage, but it's only been a couple of years of working in the industry, and they might even be in their 20s or 30s. In terms of symptoms, many people often present with no symptoms or report no symptoms, and they're only picked up on routine kind of health monitoring or health screening that occurs in their workplace. But upon further investigation, they had things like shortness of breath and inability to walk up a flight of stairs. They may have a cough. Oftentimes people present with a lot of difficulties managing fatigue and feeling very tired. There can be chest pain, that kind of pleuritic pain, and in some situations, significant weight loss. So it has a huge impact on people's quality of life, and I guess on the entire family, particularly if they still have young children or they're thinking about having a family, and it's a huge impact on everyone involved. So how did we get here in terms of engineered stone? Well, over the 2000s, there was a dramatic increase in the popularity of engineered stone products. It's a very fashionable product. You can get it in almost any color. There's lots of different kind of decorative elements, and you can use it in your bathrooms or your kitchens. And I'm sure Professor Zosky is going to go into this in much more detail, but obviously a huge kind of concern, I guess, is that the engineered stone slabs are comprised of 80% or more crystalline silica, but there are also the decorative elements like bits of glass and resins and things like that also become dust when you're grinding the engineered stone slabs. The 2010s, we started to see reports emerging from places like Israel and Spain on the higher than expected numbers of silicosis cases that was associated with workers in the engineered stone industry. And in 2016, we had our first sort of reported case of silicosis in Australia associated with the engineered stone industry in Queensland. He was a man in his 50s. And he was presenting with quite significant lung damage. And it's hard to say when data is when we're relying on things like compensation cases, we don't have a comprehensive registry. But as of May 2022, 579 cases of engineered stone silicosis was recorded and reported on by Ryan Hoy and colleagues. And that's around 1 in 4 stone benchtop workers who are diagnosed with silicosis. The other important thing to realize and appreciate is that around half of those who are diagnosed in the engineered stone industry are from migrant backgrounds where English is not their first language and maybe their second or third language. So these numbers, are quite alarming and, have been referred to as an epidemic in the media and elsewhere. But it's really important to know that just within this small industry of processing engineered stone benchtops, we're seeing these much higher than expected numbers of silicosis. So I guess in terms of what has been done about this slide is a bit overwhelming here, but I just wanted to pull out some of the key milestones and key moments in the response from the government. I've sort of highlighted this first step on the timeline because obviously that predates the kind of the silicosis epidemic of engineered stone. But it's important to know that in 2006, there was a Senate inquiry into workplace exposure to toxic dust, which a lot of the recommendations around, or I guess the things that were discussed around our understanding or lack of understanding in terms of comprehensive data and things like nanoparticles and big questions that we had about silicosis and exposure to silica dust, were happening in those, in 2006 before we even realized or appreciated what was happening in the engineered stone industry. In response to those first few cases of engineered stone silicosis, the COAG Health Council got together in 2018 to discuss this, and Safe Work Australia members agreed to review the workplace exposure standard. And then in 2019, the National Dust Disease Task Force was established, and the workplace exposure standard was reduced from 0.1 to 0.05 milligrams per metre cubed. The National Dust Disease Task Force worked really quickly, and they came out with some interim advice, which they provided later that year in 2019, which was agreed to by all governments. But then, of course, we had the COVID-19 pandemic, and the National Dust Disease Task Force were only able to provide their final advice in 2021, which again was agreed to by all governments, either in principle or agreed to outright. In 2022, Safe Work Australia did a big consultation on how to manage respirable crystalline silica at work. And in late 2022, Lung Foundation Australia, our occupational lung disease program, became fully funded by the Department of Health and Aged Care. And part of that was delivering the penultimate draft of the National Silicosis Prevention Strategy, which we delivered to the Department of Health in June last year. And that involved a whole range of different stakeholders and consultation to ensure that we had kind of covered off all of the key components in terms of a national silicosis prevention strategy. And then late last year, Safe Work Australia released their Decision Regulation Impact Statement on Engineered Stone, which resulted in all of the workplace health and safety ministers meeting in December, and they agreed to the ban on engineered stone. And legislation came out adding silica as a function to the Asbestos Safety Eradication Agency, as well as the operationalisation of a national occupational respiratory disease registry, which is due to become functional in May, which is very important and exciting. But I guess in terms of the recommendations from the National Dust Disease Task Force, there were a lot of recommendations that came out in that report in 2021. A lot of it was around strengthening workplace health and safety measures, which included the recommendation for a ban on engineered stone by July 2024 if there were no improvements in cases and regulator response, etc. They recommended developing national guidance on identifying at-risk workers, being more strategic and coordinated about how we conduct and invest research in research on occupational lung disease, establishing a cross-jurisdictional governance mechanism for occupational lung disease, investing in prevention activities, which included that national silicosis prevention strategy, education and awareness campaigns, early detection and rapid response to emerging respiratory risks, as well as better supporting impacted workers and also better supporting medical health and other professionals to be able to improve the diagnosis and management of these conditions. So as you can see from the checkboxes, Lung Foundation Australia are either funded directly or in partnership with other peak key bodies such as the Thoracic Society of Australia and New Zealand to deliver on some of these recommendations. And indeed, we have been advocates for a ban on engineered stone, which is what I'll touch on now. So Safe Work Australia released their Decision Regulation Impact Statement. It included a comprehensive independent evidence review. They conducted a far-reaching impact analysis looking at the health benefits and the financial and qualitative costs to industry and government. And they actually considered 3 different options. So there was a ban on all engineered stone, a ban on engineered stone with greater than 40% respirable crystalline silica, or the option 2 plus a licensing scheme for workers working with products with less than 40% respirable crystalline silica. And when all of that was considered, the recommendation was for a full ban. So on the 13th of December 2023, all the workplace health and safety and workplace relation ministers met and agreed to uphold that recommendation and agreed to a ban on the use, supply, and manufacture of all engineered stone, beginning, I guess, or by July 2024. I guess the important thing to consider here is what is engineered stone. So this decision excludes things like bricks, concrete and cement, pavers, porcelain, ceramics, roof tiles, grout, mortar, render, and plasterboard, etc. And I think what's really important to know is that this is not a magic wand solution. This doesn't make everything go away. And so one of the kind of included in this decision or agreement to a ban was that Safe Work Australia should amend the model workplace health and safety legislation for additional training requirements, air monitoring requirements, and reporting of workplace exposure standard exceedances to regulators in all industries where exposure to respirable crystalline silica occurs. And that's really important because even if we consider things like the latency period of silicosis emerging, so even though there's a ban on engineered stone as of July 2024, we're still going to see cases occurring in people who have been exposed already. We also need to be mindful that it's not just the engineered stone industry, and as I mentioned, there are workers across mining, tunneling, quarrying, construction that are all potentially exposed to crystalline silica, and they need to be supported and monitored, and we need to be aware of that. We don't just, feel like this is over just because we have banned engineered stone. And I think it's also really important, and part of our kind of key messaging is that for those workers who are in the industry at this point in time, that we need to be looking at ways that we can retool, retrain, and suitably rehabilitate these workers into an appropriate job, alternative job, if that's what they require. So Lung Foundation Australia, we have a whole host of different support and resources. As Sabrina mentioned, we have telehealth-based services for people who are impacted or think they may be impacted by silicosis, as well as their families. We run an annual awareness campaign, and we actually, funnily enough, we tend to focus on those industries that are not engineered stone benchtop workers. We kind of, have toolbox talks and things like that for tunneling and mining and quarrying and manufacturing. We also have various different fact sheets and booklets, and a lot of those have been translated into languages such as Vietnamese or Arabic to make sure that we're getting the message out there. But yeah, there's a lot of work that needs to be done still, and it's important and a positive step that we're banning engineered stone, because it's clear that we're not able to keep our workers safe. But yeah, there's a lot that needs to happen. So thank you so much for the opportunity to present. I'm sure Professor Zosky will go into some of those points in more detail.
Thank you so much, Sharna. That was a very enlightening presentation. Your expertise and insights have provided us with a deeper understanding of the emergence of engineered stone as a source of silicosis exposure and its implication. And it's great to see that Lung Foundation Australia has done a lot of work in advocating and educating people regarding this issue. We don't have any questions yet in the chat, but we can talk about that later after Graeme's presentation. So our next presentation speaker is Professor Graeme Zosky. Professor Zosky is the Associate Dean Research Performance for the College of Health and Medicine at the University of Tasmania. He is an academic leader with 2 decades of experience in the tertiary sector in roles focused on research and research performance and tertiary level learning and teaching programs. Professor Zosky also runs a research program aimed at understanding occupational and environmental determinants of respiratory health. We are thrilled to have you join us here today, Graeme. Over to you. Do you want to share your screen?
Will do. Thank you so much, Sabrina, and thank you, Sharna, for the wonderful presentation and for all the work that the Lung Foundation has done to support this really important cause. Hopefully that's sharing. Is it all good, Sabrina?
Yep.
So thank you very much. With Sharna's excellent introduction, I'm going to focus a little bit more on the detail of engineered stone, what it is and how the lung responds to it, with a particular focus on how we need to think about this area moving forward now that the ban is coming into place in just a few months. And so what I wanted to do to start with is really just to call out the efforts that have happened around Australia and why Australia is kind of leading the way in banning these particular products. And it's largely the work of a number of individuals and organisations, the Lung Foundation, who we've already heard from, and the Thoracic Society, who Sharna mentioned. But really, there's been some really excellent clinical work in this space. And as Sharna mentioned, Dr. Ryan Hoy and colleagues did some of the initial work outlining the case studies and the case series that documented this particular condition, and more recently have done some really comprehensive work trying to understand what the risk factors are for developing engineered stone-associated silicosis. And as Sharna mentioned, more than a quarter of individuals who presented for some of their work, from some of their studies for a screening program, showed evidence of silicosis. It's also important to call out the work of people like Debbie Yates and Susan Miles from the Occupational Environmental Lung Disease Special Interest Group and TSANZ, who've been really vocal advocates for doing something in this space, and important parts of the National Task Force. And on the right, there's a graph from some of the work done by Dan Chambers, and Sharna mentioned this as well. This is some of the work that's been done in Australia, looking at how we manage people who unfortunately develop disease. And Dan's work, particularly in the space of whole lung lavage, has been really instrumental in thinking about how we might treat people moving forward. So I really just wanted to highlight how Australia really has been leading in this space. And it's really interesting to see how the policy landscape has emerged from this. And Sharna gave a really lovely overview of how this worked. I really just wanted to bring this up also. And I wanted to mention that parliamentary committee that was done in 2006. And it's really interesting to look at some of the quotes from that particular inquiry. And there was expert testimony that was given at the time that said the silica issue is in medical terms basically over. It's a great success story. The Australian industry is free of silicosis by and large. And it's really interesting to think about how the corporate memory of society isn't very good, and we very quickly forget about a risk if it's not present or it's not overt in the areas that we're working and living. And I think silicosis is a really interesting example of that, because it's one of the oldest known occupational diseases. We've known about it for over a century, and it's really interesting that in modern times that we see re-emergence of diseases that are entirely preventable. And so in a really rapid space of time, we saw the emergence of these products onto the market. As I mentioned, the corporate memory was very poor, and there was some really poor practices around how these products were fabricated, how they were cut, how they were ground, how they were polished. And we had some really tragic and high-profile cases. And this is a picture of Anthony White from the ABC, who tragically died of engineered stone-associated silicosis. And it was really interesting, I suppose, from a policy point of view, in how rapidly this turned around to a ban in 2024. Now, unfortunately, several people have lost their lives as a result of this tragic situation, and many will have lives of them and their families impacted by this for many years to come. But in policy terms, and for those of us who work in the Centre for Safe Air, who've been advocating for change in the air pollution space, this sort of turnaround from the emergence of a disease to a policy is actually fairly rapid. And so in some ways, Australia is leading the way in that space. But as I said, there's many people have unfortunately lost their lives as a result. And so the question that I have been asking and have been thinking about quite a lot is, have we solved the problem, or will we solve the problem by banning this particular product? And then Sharna really quite nicely framed at the end that we can't afford to take our foot off the pedals when it comes to occupational health and safety. And in this case, we're talking about occupational lung disease, so particularly in the lung disease space. And so when we're thinking about how you protect a worker in a work environment, many of you would have seen a diagram that looks like this with a hierarchy of controls. The most effective approach is to eliminate the hazard from the situation, and the least effective way of protecting a worker is to use personal protective equipment, or PPE. And so the ban on engineered stone has kind of been framed around this idea of elimination, but I would actually argue that it's probably more like a substitution rather than an elimination problem in the hierarchy of controls. And the big challenge will be in the legislation is how will engineered stone be defined? And while the legislation hasn't come out yet, and WorkSafe hasn't modified the working model at this stage, the definition that's kind of been bandied around as part of this conversation is engineered stone is defined on the basis of it containing crystalline silica. And clearly it's an artificial stone, and the way that it's actually made is you grind up silica and other things, and you bind them together with a resin, and then there's some sort of process that goes to hardening that product into the finished thing that makes it a lovely bathroom or kitchen bench top. And so the challenge for me, or one of the interesting questions to ask, is if you define it this way, have you actually solved the problem? And are you just going to see an emergence of a whole range of other products which are just substitutes for this definition of engineered stone if it truly involves the containing crystalline silica? And so two of the research questions that I've really been interested in is firstly, why are engineered stone dusts so potent? Why did we see this massive emergence of disease that led to a legislated ban coming up in the future? And what are the health effects of the other components of engineered stone, both in terms of how that might explain why these engineered stone dusts are so potent, but also in a world where crystalline silica is banned from these products, are we at risk of having more products that cause a risk to respiratory health entering the market? And so this is where most of my work has been in the last couple of years in this space. And so I just wanted to show this slide, which kind of is a high-level overview of the approach that we've been taking. And I absolutely want to call out my colleagues and collaborators from the University of Adelaide, who were instrumental in contributing to the risk assessment that was conducted by WorkSafe, their occupational hygienists and exposure scientists by trade, so Sharon, Chandy, and Dino, and have really been fantastic collaborators in this space. And it's really been, I think, an excellent example of bringing two fields together, the exposure science, occupational health, to my side, which is more around the lung disease and lung pathology space. And so our broad approach is summarized in this picture here. And so on the top left here, we have some engineered stones from a single provider. And you can see, as Sharna pointed out, you can get quite a variety of shades and different speckles in these products, which is driven by the different chemistry of how they're made. So clearly the chemistry of the dust derived from this particular stone is going to be very different from this particular stone. And so what we've done is made sure that we generate the dust in as realistic a scenario as possible. So we're using the tools that workers would use. We're cutting it in a controlled environment and then collecting the fraction of dust that's produced that you would inhale. So this is what's known as the respirable fraction. So these are the small particles that will make it past your upper airway and into your lung. Sharon and the team are then characterizing the size of the particles and their chemistry, so we get a really comprehensive understanding of the kinds of dusts that are generated. And in our lab, we're exposing lung cells to these dusts. And the way that we're doing it is we're focusing on a range of different lung cells that we know are important in disease. There's a cell called a macrophage, and the macrophage is kind of a sentinel cell that sits in your lung, and it's their job to gobble up pathogens and particles that enter the lung and then decide what to do with them. And so macrophages are really critical in silicosis because they generate all of the danger messages that cause the damage to the tissue and cause the scar that's characteristic of fibrosis. We're also looking at epithelial cells, and epithelial cells are the cells that basically line the airways and the parts of the lung that exchange the air and get it into your bloodstream. And epithelial cells are kind of the first point of contact with with engineered stone particles when you inhale them. And we're also looking at fibroblasts, but I'm not going to talk about those today. Fibroblasts are the cells that cause the scarring that's characteristic of the silicosis. So what we're doing is we're taking the dusts that are generated under these real-world conditions, characterizing their chemistry, exposing the cells, and then monitoring how the cells respond in two different ways. We're measuring a range of things that we know are related to the development of silicosis. And we're also using this technique called RNA-seq. RNA-seq is really just a screening tool that allows you to measure the expression of more than 20,000 genes at once, so we can get an understanding of how the cells are responding to these particles. I'm going to show you a slide that has a lot of information in it coming up and a lot of data. I don't want you to focus too much on the detail because there is a lot of detail in here. I'm going to try and point you to the important bits of the study that we did. So as I said, there's a lot of information here. I want to focus for the moment on this top left table here. And this is the result of that study that technique that I mentioned called RNA-seq, where we screen more than 20,000 genes simultaneously. And the purpose of this is to look for patterns in the cell response that we can identify that are specific to engineered stone. And so what we did is we ran an analysis in the two different cells that we're interested in. So the macrophages, which gobble up the particles, and the epithelial cells, which line the airways. This is the epithelial cell data. We had two different kinds of engineered stone. labeled engineered stone 1 and engineered stone 2. And this is a standard silica, so essentially pure silica crystals that you would get if you were cutting up a natural stone containing silica. So what we're trying to do is to see if there's something special about engineered stone. And in this analysis, we identified these genes here, the details of what they are doesn't really matter, that were entirely specific to engineered stone and weren't changed in response to standard silica. So this would suggest to us that these epithelial cells are responding in a particular way to engineered stone that you don't see to standard silica. And what was interesting is when we looked at the macrophages, we could see these same genes popping up here. Now, there's definitely a signal and a response to silica because we know that silica causes an adverse lung response, but none of the genes that we found in the standard silica were observed in the engineered stone, again suggesting that the engineered stone causes a very specific response in the cells that may explain why they're so potent. What we then did is we looked at how much these genes were expressed, and we found some really interesting results. I'm just going to focus on one graph because all of the other graphs basically show the same pattern. So here we have epithelial cells. This is a control cell that hasn't been exposed to any particles at all. This is one of the genes that we identified over here. And what you can see is for engineered stone 1, you have a very large response in this particular gene to that particular stone, compared to the standard silica where there's no response at all. But what was really interesting is the fact that a different engineered stone caused a different magnitude of the response. So not only is there a very specific response by the cells to engineered stone, but not all engineered stones are the same, which probably makes sense given how much variability there is in the chemistry of the engineered stones, which I'll show you in a minute. So is the lung cell response to engineered stone dust fundamentally different? The answer is yes, but not all engineered stones cause the same level of response. So what we then did is a much broader study. And again, I'd like to call out my colleagues at the University of Adelaide for their assistance with this work. And we collected around 50 different engineered stones from a range of different manufacturers. So these are the standard engineered stones that were on the market and will be banned moving forward. We also looked at some of the newer products that are emerging on the market that are labeled as low silica or no silica. We also had some natural stones and some alternative building products, which are essentially bricks and mortar and that sort of thing. And so what I'm showing on this graph, and Sharna really nicely pointed out the fact that engineered stones have really high levels of silica, but not all engineered stones have the same level of silica. So we have the blue and orange components of these bars represent two different kinds of silica. So cristobalite and quartz are silica with different crystal structures. And you can see that some products, for example, this one over here, have quite a lot of cristobalite in them and not much quartz. Whereas this product, just to the right of it, has lots of quartz and not much cristobalite. You can also see in the grey parts of the bar, this represents the resin. So you can immediately see just from looking at this graph that the quantity of silica in the products varies wildly, and also the amount of resin in the products varies. And the bit that makes up the other 100% are the other components that make up the products, which include things like metals and other minerals that give you the marbling effects and the different colors that you see. It's also interesting to note that some of these low silica marketed products actually have levels of silica that are very similar to other products on the market. And again, and important also to note that natural stone also contains silica, and it's likely that we'll see an increase in these coming onto the market as the engineered stone disappears a little bit as a result of the ban. So one of the things that the colleagues in the University of Adelaide did, the first things that they did was they measured the particle size of the dusts that were generated by cutting these products. And so these are all of the samples that we had. On the y-axis here, we have the size of the particle. This here is 1 micron. And to give you an idea of how small these particles are, a human hair is about 80 microns in diameter. So here we're looking at 1/80th of the width of a human hair. And most of the dust that's generated by these engineered stones when you cut them are much, much smaller than that. And there's a really interesting pattern here that I want to highlight. The first is that the natural stones, which are in these dashed lines here, tend to have bigger particles when you cut them. Most of the engineered stones are down here. These lines here with the symbols are the low silica products. So this would suggest to me that the low silica products tend to generate smaller particles than the high silica products. Now, why is this important? It's important because we know that particle size affects the lung response. But if you look at the way that PPE is tested, And most of you would be familiar through the COVID epidemic and the bushfire emergencies that we've had about P2 masks. If you're testing a P2 mask, this is the size range that you test for. So this would tell you that most of these low silica products, if you were wearing a P2 mask as an example, PPE, to protect yourself, would have absolutely no effect. Well, we would, actually, that's not true. It may have an effect, but we don't know whether that effect is real or not, because they're only tested in this narrow band. And most of the particles that are generated by cutting the low silica products are much, much smaller than that. We also measured the chemistry, and there's not much to take in here other than to highlight the fact that there was considerable variability in the amount of metals that were in the individual products, which is important in terms of the cell response. So what we then did is we took all of these products, we cut them under real world conditions, collected the respirable dust, and then put them onto the cells to see what would happen. And again, the details don't matter here, but hopefully what you can appreciate, maybe I'll focus on this one on the right to start with. This is a chemical mediator that's released by a macrophage when it senses a threat. So if you see an increase in the levels of this mediator, that suggests that it's generating an inflammatory response. And that's these sorts of inflammatory response that actually damages the healthy tissue around the macrophage when it responds to the silica. And what you can see is that the amount of this mediator that's produced varies considerably. So again, not all engineered stones are the same. And the question is, what is driving this variability in the response? We know that the chemistry and the particle size varies between the samples. We now know that the cell response varies depending on where the dust is drawn from. The question is there a relationship between those two things, the particle size and chemistry and the cell response? And so we did an analysis to try and look at that. And what we found were two things. Firstly, the amount of quartz, which is a type of silica, that was in the particles was indeed associated with the inflammatory response. So more silica, more inflammation. And in a sense, this is not surprising because we know that silica is a pro-inflammatory particle. And this is one of the reasons why it causes this disease silicosis. So it's quite right for us to be concerned about the amount of silica that's in these products, because indeed, the higher the silica, the more inflammation that it was generated. But what was interesting and comes to this point around what happens when you remove silica from these products if new products enter the market, or is silica the only part of the story? And we found that the amount of cobalt and aluminium are important parts of some of the colors that you get in the engineered stones. These metals were also associated with macrophage toxicity. So the higher the cobalt and the higher the aluminium, the more likely the macrophages were to die. And if a macrophage dies in the lung, that causes an adverse series of responses that can also lead to inflammation and scar formation and so on. So I suppose the key takeaway message from this work that we did is that silica isn't the only part of the story. So as expected, silica was associated with the response, but other elements were also linked to a pathological response in the lung cells. So of course, you know, with any great story, that's not all there is to it. And so is this the whole story? And the short answer is no. And so what I'm showing here is a graph that shows the relationship between a marker of inflammation, so how much inflammation and cell death is happening in the lung cells, and the amount of quartz that's in the dust. And so, as I mentioned before, the higher the quartz, the greater response. And this is pure silica. So this is the standard silica. And so indeed, if you put pure silica onto a cell, they have a really big inflammatory response. So silica is definitely a concern. And that's what causes silicosis. What was really interesting for us is these particles down here. Now, these particles are low in quartz, but they're causing an inflammatory response that's one of the greatest that we observe, almost as high as pure silica. And it's interesting to note that this BM1 here is one of the alternative building products. And these two products here are the natural stones. So again, when we're thinking about banning these products, and Sharna made a really good point at the end, we need to think about protecting workers from all of these dusts that are generated by cutting any of these materials, because banning engineered stone isn't the only solution. And it's really important that we make sure we protect workers when they're cutting any of these products, because clearly our results show that these other building materials are a concern, and the natural stones, which I suspect will become more common in the market as engineered stones are banned, are also a significant cause for significant concern for respiratory health. And one more interesting point before I wrap up, and again, I'm calling out my colleagues at the University of Adelaide, who did some really important work, and this work has largely flown under the radar, I think. But what they showed was that when you fabricate engineered stone, when you cut it, It also releases volatile organic compounds. And volatile organic compounds are gases. The kinds of volatile organic compounds that were released when you cut the stone are known lung irritants. And it's likely that these are being generated by the resins as they're burning when you cut them. And all of the PPE, all of the respirators and that sort of thing are designed to protect you from particles. They're not designed to protect you from gases. So I'm also concerned about the fact that if new products emerge on the market, you remove the silica, they're probably likely still going to contain resin because you need to bind everything together to make it hard. And we need to remember that resin, when you cut it, also causes a potential respiratory hazard. So there are so many hazards in cutting these products that I totally support the ban on them, but we need to be careful that we don't think that we've solved the problem. And so where to from here? So it's clear that the lung cell response to engineered stone dust is fundamentally different to silica derived from natural stones. So I think this partially explains why the disease severity is so, partially explains disease severity in engineered stone associated silicosis. Sharna mentioned the fact that it develops over much shorter timeframes. But it also points to potential therapies because at the moment, we don't have a cure for any form of silicosis. So if we can use that signal in these cells to potentially identify new treatments that could lead us a path forward for potentially helping the unfortunate workers who already have evidence of disease. There is certainly a link between the cell response and silica, as expected. The reason why people were so concerned about these products and why it causes silicosis, but other elements are also linked to pathological responses in lung cells, including cell death. And silica is not the only contributor to inflammation, as we clearly show that the natural stones and these alternative building products, which have low amounts of silica, also cause a really big inflammatory response. So my concern, and it was really interesting when some of the media came out when we published some of these findings, but the questions I got asked, well, what would you use as an alternative? And all I kept saying was, we're having the wrong conversation here. This isn't about one particular product being bad and all of the other ones being safe. Irrespective of what product is being cut, fabricated, whether that's a tile, a brick, concrete, bitumen, whatever, a worker should not be inhaling any of the dust generated from cutting those products, irrespective of what the product is. And so my concern is that the proposed legislation, which I think is an excellent move forward, risks the perception that the problem is now solved. And so I would say that we must protect all workers from all respiratory hazards in the workplace, irrespective of their source. Because we know that dust-induced occupational lung disease is typically incurable, although there is some work in progressing this space forward, but it's entirely preventable. Any dust disease resulting from cutting any of these products or non-engineered stone products is a hazard to respiratory health, and all you need to do is to prevent the worker from inhaling them, and you don't have disease. And we've known about that for a century. We've seen re-emergence of things like coal workers' pneumoconiosis in Australia, which again is taking the eye off the ball. You know, we know that inhaling coal dust causes disease, and we see an emergence of disease in workers working in this industry in the modern times, which I think is a terrible outcome because we know how to prevent workers from getting these diseases. And so again, my concern is that we're having the wrong conversation, and it's time to use this as a lever to raise occupational lung disease is something that we should be concerned about and that we should do something about, and should be eliminated in a country like Australia where we have really a good opportunity to control some of these exposures. Thanks very much for your attention.
Thank you so much, Graeme. That was a very insightful presentation, and there's no doubt that your research has contributed significantly to the field. Now I'll open the floor for any questions that the attendees may have. The first question is from Tilka to Sharna, I believe. Tilka asks, what is the impact on product makers and industries when the government bans the use of engineered stone?
That's a really good question. I think obviously it's going to have a huge impact on industry. And, you know, we've kind of seen that before when Australia sort of led the way in terms of banning asbestos as well. I think what is, and I tried to showcase, is that this isn't a decision that has been made lightly or quickly, necessarily, maybe too slow for some people who are more kind of, you know, advocates in this space. You know, various different options have been weighed up, and they've looked at like the financial impacts to industry, some of the qualitative costs as well. So Safe Work Australia didn't take that lightly when considering the benefit of a ban. So as Graeme said, and so passionately said, you know, we need to be considering that even if we have things like respirators, or we know about the hierarchy of controls, and in theory this should work, and I mean, this is an entirely preventable condition, it's clearly not happening in practice. And I think that was a key thing that Safe Work Australia looked at when they were deciding on a ban, is that this, you know, it hasn't worked. And so the only solution for us moving forward is to ban the product. But it will have an impact. It's going to have an impact on workers. And that's why we're so keen to see that there is adequate rehabilitation and vocational sort of support for people to retool or retrain. But yeah, it's a decision that's not made lightly. It's for the health and the benefit of workers, and all workers exposed to dust, as Graeme said.
Thanks, Sharna. The next question is from Michael. Michael said that the Commonwealth has the power to ban importation of engineered stone. However, implementation of occupational health and safety is up to the states. Tasmania is already lagging the chain and has an election coming up in which this is not an issue. What can Lung Foundation Australia do to ensure that engineered stone stays banned if there is a change of government in Queensland?
That's another really, really good question and a really good point. So yeah, absolutely. It's a very complex thing that's happening, and it is up to the states. And I think that's some of the challenge that we've seen in the response to occupational lung disease so far, is that certain states are doing certain things differently. And even with the registry that's about to become operational in May, silicosis is the only one that is notifiable. But then obviously if you go to Queensland, you need to notify of other coal workers, pneumoconiosis, for example. So there's a lot of complexity when it comes to what's happening across each state. In terms of what Lung Foundation Australia is doing and will do, we have a strong sort of policy advocacy and prevention team here, and we just use our platform and our relationships to kind of advocate for this. And it's a key priority for us moving forward, is to make sure that everyone kind of keeps their eye on what they've agreed to, and hopefully enacts it quickly and consistently, again, for the protection of workers. But yeah, that's and we like to work with other people as well. So other partners, you know, if we're releasing like position statements or meeting with ministers, then we work closely with other peak bodies like the Thoracic Society of Australia and New Zealand, you know, whether it's medical associations or other not-for-profits. We're always keen to kind of make sure that we are staying in their faces. But I guess that's all that we can do as we see how this plays out across.
Thanks, Sharna. The third question is from Jeff to Graeme. He said great work on highlighting the risk of engineered stone and silicosis, and he's wondering if there are moves to consider the respiratory health risks from the range of other occupational exposures that generate dust and respirable particulates. For example, kitchen renovations involve tiles, carpenters, plasterers, etc., as well as the engineered stone bench tops. His impression is that a combination of time pressure, practicality, and limited understanding of the risk means that many building trades don't appear to fully appreciate the risk of dust exposure and the importance of minimizing dust and avoiding exposure and PPE use. So what do we know about exposure to other dust generated during building or renovations, and what do we know about the understanding of health risk and exposure minimization practices in building trades?
Thanks, Jeff. That's a really great question, and there's a lot in there. So there's a couple of things that I will respond, and I'll use tile as an example because I actually think that's an excellent example. And we've just done some survey work looking at engineered stone, but also tilers in particular, and it actually originated from a personal experience where I was having the tiles done in my kitchen, and I was watching the person who was doing the tiling cutting the tiles in our driveway, who had the PPE sitting next to them as they were cutting the tiles. So it was there, and they could have worn it, and they clearly got it out of the box that it was sitting in, but then they didn't put it on. And so it is really interesting because there's a lot of layers in this. There's the legislative aspect of what a company should do to protect its workers. There's how that's then implemented in practice, which Sharna mentioned, and then it's how the worker themselves manages their exposure. And I think tilers are really interesting, Vilma, because they're often sole traders. So their risk and their requirement to occupational health and safety is to themselves. So it's not, so which isn't captured well in work safe legislation. It's not captured well in a regulatory environment. So it really does rely on the knowledge of those individuals about protecting themselves. And I think it's a really interesting question. And this sort of the health behavior part of it is really interesting. It'd be really interesting to look to see whether behaviors have changed with the emergence of the, I suppose, the publicity around engineered stone. But when we surveyed engineered stone workers and we surveyed tilers, there was a significant proportion of them who clearly didn't appreciate the risk. And we got some help from some people with some expertise in health behaviors and psychology to frame the questions. And it was clear from some of the responses that some of them don't see this in a risk. And it's kind of that that issue around not seeing it. So you know, I've been working in this industry for 20 years. I've never had a problem. My friends never have a problem. And so I think one of the horrible benefits of the engineered stone piece and how sick people got so quickly is it might raise the profile of it. But again, I suspect we'll forget, you know, when that visibly goes away, people will start to become less and less concerned about it. So it's a really difficult situation. Some industries are really great around understanding the risk. People still get disease, which is an interesting question. But yeah, it's a really difficult one, particularly for I think for the smaller traders. And it is, and I also wanted to think about that. You had a great response, Sharna, to that previous question. But you know, 15 years ago, this industry existed. They just didn't use engineered stone. You know, so we're always going to need bench tops. We're always going to need kitchens and bathrooms. It's just that the products will likely change. So I don't think there's going to be a massive downturn in the industry. It's just they'll largely be working with different products.
Thanks, Graeme. So the next question is also from Michael. Michael is wondering, would most of the ultrafine particles from the low silica products simply be exhaled and not much deposited in the lungs?
That is an excellent question, Michael. So for those who probably aren't familiar with this concept, so there's a certain particle size, which is roughly 10 microns or so, that makes it past the upper airway and gets into your lungs. Those size particles, those sort of 5 to 10 micron ones, if you let them sit in air, they will settle. And so those sorts of particles you inhale will settle into the lung and they'll come into contact with the cells. As you get smaller, the time it takes for a particle to settle increases. So very, very small particles, it's possible that you will inhale them and simply exhale them again because there's not enough settling time for that to occur. There is actually an interesting U-shaped curve, Michael. So there's a sweet spot where most of the particles come back out. But when you get down to a small enough size, you get enough, for want of a better description, sort of Brownian motion, a bit like a gas, where they will come into contact with the tissues in the lungs. So it's possible that the very, very small particles will actually deposit by a different process to deposition. So it is a really interesting question. I don't know the answer to that, to whether or not those particular size particles will mostly be exhaled. It'll be interesting to think about whether you can inhale them and then what the mask does to try and exhale them again. So there's a lot of interesting questions in that space, but good one.
Thanks, Graeme. The next question is, what are the current effective methods suitable for the construction industry that can protect workers from inhaling all dust types, especially dust smaller than P2 mask filter size?
That is a great question. I don't know if you know more than me, Sharna. I don't know the names of all of the other particular kinds of respirators. I know that once you go past P2 mask, you're talking about probably a respirator, something that's much more effective at removing a higher percentage of the particles. So a P2 mask, my understanding is they only need to remove about 94% of the particles in that sort of respirable fraction. And the higher you go in the respirators, there was a picture, I think, in yours, Sharna, that showed a worker wearing the more hardcore mask with the big filters on it. That's better than a P2 mask. It will filter out more particles. But really, the best control mechanism is to eliminate it. And I know that there's a lot more automation has come into the industry as well. So a lot of the machining is done without a worker sitting side by side. And there is a requirement in some places for if something doesn't fit, it's supposed to go back to the factory, but whether the worker's actually going to take the bench back from the house all the way back to the factory to get it cut is an interesting question and would potentially expose people. So I'm not sure I answered the question, but the more sophisticated the respirator, the better the PPE protection. But of course, that increases the cost as well.
Yeah, I would agree. I think, yeah, absolutely. I had a photo of someone with the half-face respirator mask in my presentation. I would just say as well, if you're curious about like information on different types of respirators and protective equipment, that the Australian Institute of Occupational Hygiene has like a breathe freely website resource that goes into mining and construction, because I noticed you also asked a question about, or someone is asking a question about mining as well later for underground mine workers, and they have a lot of resources for the different industries there that go that include silica, but also speak about things like diesel engines underground, coal dust, etc. So there's some really great resources on the Breathe Freely website, which is affiliated with the AIOH. Lung Foundation Australia also has a on-demand webinar. I don't know if I can spruik that, but if you want more information on respiratory protective equipment, there is an occupational hygienist, Mark Regis, who presents on that topic as well.
Thanks, Sharna and Graeme. So I think that was the last question. Let me just double check. Yep. And we're reaching to the end of the webinar anyway, so I'll conclude. I just want to extend my sincere appreciation to Sharna and Graeme for their excellent presentation on this topic. We hope the attendees have found the information valuable and insightful. If you have any further questions or would like additional resources, please don't hesitate to reach out to us. And we look forward to seeing you at the next webinar. Thank you and have a wonderful day, everyone.